Welcome back. We're talking with Pam Sasser, Breast Health Nurse Navigator for St. Peter's Health. Welcome back.
Thank you.
Yes. So I'd like to go back to something we talked about earlier, and that is breast cancer prevalence in men. Can you tell us how common that is?
It's actually not that common.
Okay.
It's probably less than 1% of the overall breast cancers that are diagnosed, but still you're looking at about roughly 2,500 males diagnosed per year, which can be pretty significant. And of course, it's a little bit more difficult when a man's diagnosed with breast cancer because there really isn't a whole lot of resources out there. The education is pretty similar, but you know, it's just trying to find that support and the acceptance.
Sure.
Because it can be pretty challenging.
Okay, thank you. So can we talk about the different types of breast cancers and the names and characteristics of each of those?
Sure. So as I had mentioned previously, roughly about 15 different types. And they can stem from, there's different locations within the breast of the ducts or the lobules. Then there's also ones that are fed by hormones, estrogen and progesterone. There's a typical, another one that's not as typical, and it's a HER2/neu, and that's a protein that can be found on breast cancers. And in about 20 to 25% of the breast cancers, that can be positive. And so one of the things people may talk about is, oh, I'm triple positive or I'm triple negative. Those cancers are a little bit more aggressive. And so, you know, the treatments are very effective, but we just want to make sure in those circumstances that, you know, we are getting on those and treating them a lot sooner. So again, it's very important for women to get in and be doing those yearly mammograms, doing your own self-breast exams and then clinical breast exams. But as far as the different types, there's also early stage, like a stage 0 is called a ductal carcinoma in situ. So, I mean, it just varies. And some women, unfortunately, are diagnosed at a metastatic stage. So, you know.
Okay. Is one type of cancer, breast cancer, more common than others?
Probably the most typically or most common diagnosis is the invasive ductal carcinoma. We sometimes refer to it as the garden variety, and that one would have the hormone sensitivity, but that HER2/neu protein negative. So that's probably the most common that's diagnosed.
Okay. And I think you mentioned this earlier, is there one type that's more aggressive than others?
Yeah, so that would be either your triple positive or your triple negative. And there has been phenomenal research going on right now with both of those types of cancers. So a lot more treatments are becoming available, whereas even just, you know, 6 months ago for triple negative, we didn't have an extended after chemotherapy therapy treatment that people could use, and now they've come out with something. So,
good.
Yeah,
good news. Do we know what the root cause of these types of cancers are? Do we have any information on that?
Well, I think we're definitely finding more links to it, but we haven't yet found, you know, like the magic culprit, if you will. Again, you know, the diet, certain lifestyle risk behaviors can wreak havoc to our cells and maybe, you know, shift a cell into behaving to turning into a cancer cell. But as it stands right now, we don't know anything specifically. There is that genetic component, but again, it's a smaller population. So definitely if there's questions in your family, you know, talk to your family members. We are very fortunate here in Helena that we have genetic counseling through Shodare Genetics. So we always encourage people, you know, if you do have a strong family history, to talk to your provider, and they could do a referral, and then they could talk about that piece. So.
Our earlier guest, Carol, her breast cancer is in remission. Can you talk about what that means?
Yes, so those are always good words we like to hear. Right now, the term that we like to use rather than remission is no evidence of disease. So what that means is everything looks clear, the scans are great, blood work comes back normal. Unfortunately, women still live in fear, you know, that it's going to come back. So it's really hard. It's great to hear that somebody's in remission or, you know, has no evidence of disease at that time. But unfortunately, that stressful emotional component for a lot of women, it just weighs heavily on them.
Absolutely. Can you talk about the different stages of breast cancer just briefly?
Yeah, so there's actually 5 different stages because we count stage 0 as one. So stage 0 would be a precancer, and then your earlier stages are your stage 1 and 2. Those are ones that sometimes just surgery alone can treat. Sometimes they require a little bit of radiation therapy after a surgery, or sometimes they need surgery, chemotherapy, and radiation. Stage 3 and 4 are a little, those are your more advanced. Stage 3 is still curable, and then when you're looking at stage 4, that's considered metastatic. So at that point, we do have women that have been metastatic with breast cancer living 25 years. So it doesn't mean that, it's a end of life sentence, but, at that point they're treating for quality of life. They're not treating for a cure, but there's still great hope with those.
So you've already kind of hit on that, and we just have a few seconds left, but breast cancer can be cured or eliminated, or is it always even there after treatment then?
It can be cured, yep. If we get it early enough and it's those early stages, we are looking at, upwards to 95% cure rates. A woman is still at risk for getting a recurrence or another breast cancer, so they still have to be diligent.
Great. Thank you so much for being here, Pam.
Well, thank you.
It was great information today. And I'd also like to thank Carol for sharing her story. See you next week. In the meantime, stay fit, stay well, and stay healthy for life with Healthy Living for Life.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Special thanks to Fire Tower Coffee House and Roasters. Production facilities provided by Video Express Productions.